what's the first question?
Chris, how can the Senate and House work together to bring back the economy and finally eliminate the constant fear the average American citizen lives in with these crises?
Yeah, so this is on the first question. So this is absolutely ridiculous, right? I mean, people don't even sort of feel like they should take the time to understand what this crisis is, because they know there's just going to be another one 2 years later. There's always a cliff, right? It was the government shutdown, then it was the taxes going up, now it's these automatic spending cuts. Here's what we have to do. You've heard this phrase, a grand bargain. We need both parties to sit down and get a deal done that sets our budget priorities for the next 10 years. It will involve some really tough political choices, because if you really want to eliminate the operating deficit of the federal government in 10 years, then there are some accounts you have to spend a lot less money in, and a lot of accounts that have some pretty powerful interests behind them, like the Department of Defense, and some people are going to have to pay more taxes. You want Medicare to be around? You got to make some big changes to Medicare. Medicare becomes insolvent in 10 years. 10 years. Social Security, which often gets most of the attention, Social Security is 20 years from now. Social Security is relatively easy because it's only a handful of levers. Medicare is much tougher. So if you want to fix Medicare, you either have to give out less services one way or another, or bring more money in. And every year that we put that off, we're making it less and less likely that that program is going to be around 10 years from now. So what I hope that we can do is, and I know the President wants to do this, and I know a lot of Republicans want to do this, is sit down and have a conversation that says, okay, we're going to fix we're going to put everything on the table all at once. No Band-Aid over here and Band-Aid over here. Let's get the operating size of the federal government right. And I'd say this, I'd say that right now we're spending at a rate of about 23% of our GDP, and we're taxing at a rate of maybe like 16% of our GDP. Bring them both together at around 19%. Republicans will say 18, under Clinton the number was 20. Bring them together around 19%, and then you'd settle this question once and for all, and then just have politicians be willing to make the tough choices on Medicare and Social Security. I mean, there's just no way around it. We got to fix those problems, and they don't involve good news for anybody. But I obviously have a personal stake in this, because if you don't fix Social Security and Medicare now, I mean, they're going to be gone way before I qualify for them, and so I'm willing to make those tough choices.
What additional measures are being planned to enhance security around our schools, and are these measures things that don't involve gun restrictions?
Yeah, so I think first of all we want to sort of set expectations right. Newtown did everything right. Sandy Hook, as far as we can tell, had their emergency drills updated, had the doors locked. And this guy blasted his way in. He blasted his way in, and there was frankly, very little that would have stopped him. A lot of the conversation right now is around whether we would make our schools safer by arming them, by putting either armed security officers in all of our schools, or whether we should arm teachers and administrators. There's some people who want to do that. First of all, I think we should listen to our teachers who did a survey across the state, and 88% of them said that the last thing they want is for teachers and administrators to be armed. And frankly, I think that the evidence tells us that even when we arm our institutions, it often doesn't stop the perpetrator, right? Columbine had armed security personnel who were in a totally different section of the school, and then by the time they got there, they fired shots that didn't hit. There was a guy with a gun in the parking lot, ready to shoot in Tucson, Arizona. He just could never get a clear sight line, so he couldn't fire. At the Army base shooting, there were clearly guns all over the place, and it didn't stop.
At Fort Hood, they weren't allowed to carry weapons.
I want to listen to teachers and administrators who I think are very wary of having heavily armed schools, and I just sort of look at the evidence as well. Now here's what I think you can do. There are some schools in Connecticut that want school resource officers, which are sworn police officers. They are armed. They generally aren't. Sometimes they are in uniform. Sometimes they aren't. I don't think that's the answer for every school, but I think it can be an answer for some schools. The president has proposed putting some funding for additional school resource officers, and I think that that's a legitimate conversation to have. I'll tell you the one drawback of school resource officers is that oftentimes they don't have a lot to do in those schools because there isn't everyday violence like there is on the streets, and so they start criminalizing behavior that used to be just taken care of by the principal. And what you don't want to do is have these school resource officers all of a sudden arresting every kid who gets into a little scuffle in the hallway with another student. And there's ways to do that. There are really good school resource officer programs where they don't do that. But that's certainly something that a lot of schools in Connecticut want to take a look at, and it's going to be something that a lot of us will be supportive of, because I know what a lot of these teachers, especially around the Newtown area, feel right now, and a lot of these students feel, and they'd feel a lot better if they had a police officer there, at least in the short run, and that's something that we're all going to be helpful with if we can.
Question about healthcare. My husband is from Marcella. My husband is a UTC retiree, 37 years of service. We pay over $900 a month for retiree healthcare. When my 24-year-old daughter decided to attend grad school, I called UTC Cigna to add her to the policy, and they were told no. The ERISA Act allowed them to deny her coverage on a retiree policy. Please close this loophole. What can be done about this?
We have the most sort of confusing, backwards healthcare system in the country, in which you have to deal with this just crazy intersection of state laws and federal laws about who can be on plans and who can't be on plans. And one of the things that we just have to do a much better job is of sort of portability, that if you have an insurance plan one place, that you can bring it to another place. One of the things that the healthcare bill does well is that it extends the number of people that can be on plans. So for instance, you have now the ability to keep your kids up to age 26 on your plan, rather than prior when they would get kicked off either at 18 or to 21. Healthcare bill goes into effect in 2014. It's going to provide a lot of additional insurance options for people that don't have them. So if you do have these plans which won't accept your spouse or your dependent, starting in about a year from now, they are going to have, for the first time ever, an affordable low-cost option, which is healthcare coming off of one of these exchanges, in which everybody who's buying on the exchange will get a subsidy dependent on their income. So if you're really low income, you'll get a bigger subsidy. If you're sort of lower middle income, you get a smaller subsidy. But everyone will have the chance to buy insurance who doesn't have it through their family in 2014 through these exchanges. And so I'll sort of, whoever asked that question will follow up with on the specifics of it. But beyond that, even if you can't fix the specifics of it in 2014, when you have these new lower cost insurance plans available to people, then that'll help a lot as well.